Limb fractures are something that often occurs, especially in smaller dogs and puppies, because they just don't have the overall bone strength that a bigger dog such as this has. In an animal like this, it takes more of a pretty severe force to break a limb. But in either case, to deal with a fractured limb, the best thing you can do is immobilize your animal and put them in a kennel or something while you're transporting them to the vet's office, because the more they move around, the more they can damage that limb. Because if it's completely fractured and it's all the way through, the more that tissue is flexed and moved around and stuff, the more nerve damage can potentially occur. So immobilizing the animal is the best thing. If the animal will tolerate it and you can do this without being bitten or causing more damage, you can actually put a splint on the fracture. And usually the guidelines are, when we splint them, we do above and below the fracture, or if it's on a joint, above and below the joint. And a magazine, a newspaper, or something of that fashion works pretty well for this, and you just basically wrap it around and then wrap it with tape and use that just as a joint stabilization tool. There are also splints available out there that can be useful. So either way, just the important thing to note is to stabilize the fracture until you get to the vet's office, because it's probably going to need to be either surgically repaired or a cast placed on the animal. And then for a compound fracture, which means the bone is actually protruding out of the skin, you can see it. It's not a good situation to be in, but just because the bone's protruding outside of the skin doesn't mean we can't save the limb. So the important thing in this circumstance is to try to clean it the best you can. And the main risk there is, once we get the animal, get the bone surgically replaced, is the risk of infection. So if you can clean the debris out and treat it similar to what we did for an open wound, and then bandage the area so that way no contamination gets back into the bone. Those are the two best things you can do, and then transport them to a vet hospital as rapidly as possible.